Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit npteff.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be discussing some helpful tips and tricks regarding pharmacology-based questions on the exam. Now, when considering pharmacology on the boards, there are three main things you should focus your attention on when studying, which includes the mechanism of drug and how it reacts on the body, what this drug is used for, and what the main side effects are. Now, there are a wide variety of drug classifications to be aware of, so try to at least focus your attention to the specific drugs you see commonly pop up on practice exams, during your clinical experiences, or throughout your school's curriculum. Now, some examples of cardiac drugs like beta blockers, spasticity medications like baclofen, Parkinson's medications like Sinemet, or pain medications like NSAIDs are common types of pharmacology-based questions that will pop up on the exam. So those are just a few examples. Now let's dive into example a little bit more specifically. Now, when considering ACE inhibitors, they do exactly what their name says they do. They block or inhibit the angiotensin converting enzyme, which in return reduces blood pressure. Now, since this medication's purpose is to reduce blood pressure, it is used for patients with congestive heart failure or with hypertension. Now, there are often a large list of side effects that are present with each drug. So the biggest thing you should take away are the main components that set this medication apart from others regarding side effects. So, for example, with hyperkalemia and a dry hacking cough, these are of note with ACE inhibitors. So these are a little bit more of those different side effects that set them apart, like I mentioned. So that is an example on how you should analyze these questions. This example we just discussed was ACE inhibitors. So we discussed what the mechanism of the medication is and how it reacts on the body, what the medication is used for, and what some common side effects seen are. And again, try to look at the side effects that set this specific medication apart from others. So now that we have reviewed some important things to focus on regarding pharmacology, let's review a practice question. A home health physical therapist has an early morning visit with the patient. Prior to taking the patient's vitals, the patient reports he had not had a chance to take his medications this morning. The patient's vitals were as follows: 132/92 millimeters per mercury regarding their blood pressure, 96% oxygen saturation, 72 beats per minute for their heart rate, and 98.2 degrees Fahrenheit for their temperature. Now, regarding these vital signs, which medication is the patient most likely on? Option A, beta blockers. Option B, digitalis. Option C, nitrate. Or option D, diuretics. And again, their vitals were 134/92 blood pressure, 96% oxygen saturation, 72 heart rate, and 98.2 temperature. Now, all of these vitals are within normal limits, except which one? If you said blood pressure, correct. Blood pressure is not correct here. A normal blood pressure is 120/80. Now, this blood pressure was slightly elevated. They were 134/92. Now, which of these medications listed can help lower blood pressure? The option is option D, diuretics. Diuretics are used to increase urine output, which in return reduces blood pressure. Now, nitrates increase heart rate, while beta blockers and digitalates decrease heart rate. But again, heart rate was normal. It was blood pressure that we were looking at, which is why option D, diuretics, is the correct answer choice. Now, I hope you found this episode diving into some pharmacology recommendations helpful. I know pharmacology-based questions can be very challenging and overwhelming when it comes to trying to remember which components of medication should you study and try to memorize before your upcoming exam. Now, remember these common tips and tricks regarding the mechanism of medication, what the medication is used for, and what some common side effects regarding that medication are. If you can use those 3 common tips when you're reviewing different practice exam questions and pharmacology-based questions, this can really help you regarding your upcoming exam. So never forget, warriors, you are powerful, you are strong, you are a final frontier warrior, and you will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Till next time, have a great day and a powerful tomorrow.